How would you like to say goodbye to these? Well, we can help you accomplish that. And no one should suffer with heavy bleeding. Heavy bleeding is characterized when you're changing a pad or tampon greater than every 2 to 3 hours. This impacts our life. Sometimes we have to take off work, sometimes we have a lot of pain, sometimes we just aren't available for our children or don't feel well. So I want to talk to you about the workup and what we can do about that. Typically, when I see a patient for abnormal bleeding, I'll examine you, make sure your pap smear is up to date. I'll order a blood count to see if you're anemic, check your thyroid, and I also order a sonogram. Once that workup is complete, you'll come back for follow-up and we'll go through all the options available to you. Some options vary depending on your past medical history, but I want to talk to you today about what's available in general. There's medical management, which can include oral contraceptive pills, Depo-Provera, which is a shot that you get every 3 months. Some people use the Mirena intrauterine device, which is a IUD that we place within the uterine cavity. That's also used for contraception, but can help a lot with abnormal bleeding. A very popular procedure is something called an ablation of the uterus, and that is how we can really get rid of these. By doing that, what we do is you receive sedation in the operating room, and I look through the cervical canal into the uterus to make sure you have a nice shape that will accept the ablation device. I then remove the camera and I place the NovaSure ablation device and we cauterize the lining of the uterus. By doing that, we eliminate or lighten the cycles. In my opinion, if we can alleviate the heavy flow by at least 50 to 60%, that's success. But some people have true success with no menstrual cycles at all. There are some drawbacks to the procedure, and one of them is you really have to be past childbearing. And either your partner needs to have a vasectomy or you'll have to have a tubal ligation to make sure there's no pregnancy. The reason for that is if you become pregnant after an ablation, it increases your risk for a tubal pregnancy, miscarriage, or a small conception growing where we can't get to it and the placenta never grows and the fetus can have malformations, and it's a bad scenario all the way around. So absolutely, you have to be done with childbearing and have permanent contraception. The other drawback is because of the scarring of the uterus, later on, it's harder to diagnose endometrial cancer if somebody were to develop that. So there's a lot of pros and cons to the procedure, but it certainly is very popular. Another option for patients is a hysterectomy. It's amazing though, between the Mirena intrauterine device and the ablation procedure, we don't do as many hysterectomies. It's just not necessary. So if you have any questions at all concerning abnormal bleeding, or if you'd like to work up for abnormal bleeding and want to know your options, we're here for you Monday through Friday. Very happy to see you. Thank you.